Hello and welcome to this tour of the anatomy of the abdominal wall and its main structures. Today we will explore the bones, muscle, blood, vessels, nerve, and also the important inguinal region. Let's imagine the abdomen as a large container. We'll start with the bone frameworks that support it, the lower costal arch, the lumbar vertebra, visual, and the pelvis. The upper limit is marked by the diaphragm. From the abdomen, a dome-shaped muscle that separates to the thorax from the abdomen. Because of the chest, part of the abdominal cavity extends over behind to the ribs. This all abdominal cavity. In the pelvis, we find the sacrum and the hip bones formed by the fusion of the ilion, ischion, and pubis. Among the most important landmarks are the iliac crest, the anterior superior iliac spine, the pubis, and the pubis symphysis, where both hip bones meet at the front. A key element is the inguinal ligament, a tendinous band that goes from the anterior superior iliac spine to the pubis tubercle. Beneath is past very important structures, the femoral artery, vein, and nerve, as well as the psoas and iliacus muscle. Together, iliopsoas. Now, let's move on the muscle at the back. We find it muscles such as the erector spine, the quadratus lumbar, and the powerful psoas major, and iliacus, which together form the iliopsoas, the main flexor of the hip. The front and sides we find four fundamental muscles. The rectus abdominis running vertically and helping us flex spine. The transversus abdominis with horizontal fibers that increase intra-abdominal pressure. The internal oblique and the external oblique, which work together for the flexion, rotation, and abdominal compression. These muscular layers are organized through aponeuroses, forming a structure like the rectus sheath, salt, in color gray, and the line alba. A tendinous line that runs from the sternum to the pubis. Now, let's return to the inguinal region. Here, we find the inguinal canal, an oblique passage through which in men passes the spermatic cord, and in women, the round ligament of the uterus. This canal has two openings. The deep inguinal ring, locally internal, the superficial inguinal ring, which open in the aponeurosis of the sternal oblique. This is sternal oblique, aponeurosis, and superficial inguinal ring. As for blood supply, the main vessel is the abdominal aorta, which descends in front of the lumbar vertebra and divides into common iliac arteries. From its arteries vital runs such as the celiac trunk, select from these: common hepatic, left gastric, and splenic. The superior mesenteric artery and inferior mesenteric artery. Other important branches are the renal and gonadal arteries. Gonadal arteries and renal. The veins accompany the arteries' blood flow from the digestive system, thus no return directly to the inferior vena cava. Instead, it first passes through the liver via the portal vein, and only then drains back into the general circulation. In the abdominal wall, we find the superior and inferior epigastric arteries, which supply the rectus abdominis muscle and connect with each other, forming an important network. Regarding the nerve, thus responsible for the motor and sensory supply of the abdominal wall or the lower intercostal nerve from T7 downward. In the posterior region, we find the lumbar plexus, which give rise to nerves such as the iliohypogastric, ilioinguinal, genitofemoral, femoral, and obturador nerve. Finally, we cannot forget the autonomic nervous system. The abdomen resides parasympathetic fibers throughout the vagus nerve, so, and sympathetic fibers through the sympathetic trunks. And the aortic plexus, which aortic plexus is all, which regulate the activity of the viscera. In conclusion, the abdomen is not just a cavity that contains vital organs, but a complex structure made of bones, muscle, vessels, and nerve that work together to protect, support, and provide movement.